killed.
BBC Verify's Merlin Thomas there. Well, let's go live to Aleppo now. We're able to speak to Dr. Mazen Kewara, who's Middle East Regional Director with the Syrian American Medical Society. Good morning to you, Dr. Kewara, and thank you for talking to us on BBC News. Can you just describe what you've been experiencing in these last few weeks?
Yeah, good morning. Thank you so much. Yeah, unfortunately, since the escalation started, we started to see again attacks on the civilian neighborhoods of Idlib and different areas in northwest Syria, in addition to unfortunate also unlawful attacks against hospitals too. And the escalation also was in this area from the different parties make a big pressure on our hospitals. So we are facing a huge number of casualties in our ERs, ORs. So we as SAM stopped the usual practice in our 9 facilities in northwest Syria and working right now under the emergency level only.
We heard that 6 hospitals were bombed yesterday in Idlib and Aleppo. Of course, this makes your job extremely difficult and dangerous. How are you preparing for what's ahead, given how difficult it is to assess what might happen next?
Yeah, this is unfortunately 2 days ago, like a air campaign against hospital in Idlib happened, and this get us back to 2 years ago when the attacking hospitals was a region like usual practice of the Syrian government, Russian forces in such escalations. So yes, it was unfortunate that 2 of our facilities in Idlib city was attacked, and both of them right now are out of service. So this is getting us to very tough, difficult situation. So our doctors, our healthcare workers and patients are not safe at all. And in such escalation, we are using very important facilities. We need them to deal with the current situation. 3 days ago, few days after the opposition forces took over Aleppo, attack against the university hospital, the biggest hospital inside Aleppo city, happened. And unfortunately, I visited it yesterday. A huge destruction. Despite the chaos in the city right now, the doctors, the workers in the hospital, they are not coming to the hospital because they are threatened from experiencing again such kind of attacks against the university hospital.
And this presumably must be impacting supplies of medicines, of equipment, of all that you need. When it comes to the basics such as power, things like that, has that been impacted in the hospitals?
Yes. We are facing kind of shortage in the fluid and anesthesia drugs. This is initially in whole northwest Syria. We are trying to deal with this situation. You know, we have an open route to Turkey, and we are getting our supplies and medications cross border from Turkey. We are trying to manage the situation, but for sure there is a big pressure there. The situation inside Aleppo City is a bit difficult. So the electricity supplement, we have a problem in the electricity. It's a chronic problem in this city since years before the new changes. But I do think that our attempts to secure kind of enough energy sources will succeed, inshallah, in the near future.
Okay. Dr. Mazen Kewara, thank you so much for talking to us about what you are dealing with, the day-to-day challenges in hospitals in Aleppo, Syria.